Greetings, it's Eric Bakker, the Naturopath. Thanks for coming back to the channel and checking it out. Today we're going to talk about onychomycosis. That weird word means nail fungus. Are you sick of fungal nails? Ugly, horrible, black, yellow nails? Embarrassing when you go out? Horrible. Let me show you how to fix it. So we're going to look at causes, symptoms, and the best natural treatments for this very common condition that affects 5.5% of people all around the world. Everybody can get nail fungus. So I'm going to talk more about it, how you get it, and how you can nail this problem. So what type of people are more prone to getting nail fungus or toenail fungal infections? Well, generally people that are older, immune compromised, people with diabetes, athletes, people that wear shoes all the time, and of course we've got office workers, factory workers, bus drivers, truck drivers, Uber drivers, like anyone who's sitting down driving a lot with occlusive footwear is going to be more prone, obviously, to having this if they're wearing footwear, several hours a day without kicking them off. And I've seen some cases that people have them for 2, 5, 10 years, even more. Sometimes one toenail is affected, sometimes several toenails are affected. The common toenail I find affected is the big toenail of the leading foot. 90% of toenail infections are caused by a fungus, what we call a dermatophyte, and the common species are microsporum and trichophyton. The same fungi that are responsible for causing athlete's foot, jock itch, and ringworm are also responsible for toenail fungus. So how do you get this problem if you're in an environment where this fungus often lives? Which could be locker rooms or gym rooms or swimming pools or nail salons, or so also think problems with sharing towels, personal items like that. This can allow the infection to spread more easily and more rapidly. I also find that guys with jock itch tend to be more prone. Once you've got one type of fungus in the body, it's not hard to develop other type of fungal infections. The problem also with nail that many people may not be aware of is that nail infections also include biofilms, where the fungus can hide inside a shield and they can share communication and resources with each other. And they toughen that matrix and make it much harder for treatments to penetrate. And then we've got lifestyle factors, of course. We've got high carbohydrate diets. We've got people who are eating a lot of ultra-processed foods. A big one is excessive alcohol intake. People who drink regularly, especially beer or yeasty kind of beverages like that. And then we've got smokers, and we've got people with obesity. We've got people with hyperhidrosis, excessive sweating and body odor and sweating. Now let's talk about treatment. How do you get rid of fungal toenails? Well, this is one of the most stubborn and difficult of all fungal infections to get rid of. It's not easy at all. It requires persistence and commitment. You need to make changes on multiple levels. It's not just a matter of taking a few antifungal pills or probiotics and it'll go away. Many people have come to me who've had this problem sometimes for years and are frustrated. They really want to get rid of it. So the first thing we're going to do, number one, is we're looking at a clean and dry environment for the foot. So we've got to make sure that we bathe the feet every day, if not twice per day if you've got a bad fungal nail, and make sure you dry that foot properly. Really dry it well between the toes, underneath, and put clean socks on. So use cotton preferably. Don't use polyester, and it needs replacing at least once per day. The trick is when you get home is to kick those shoes off. Walk around bare feet like I do, or just, put some light sandals or some shoes on that allow the toes to breathe. And the second one is the sun and the beach or walking bare feet outside. This is a quick way to eradicate a yeast infection, is to go bare feet every single day and put it in the sunlight for 15 or 20 minutes. Better still, if we start looking at topical applications of tea tree oil, oregano oil, or we start bathing it a bit with apple cider vinegar to change the pH around the foot, this will create a fungal shift as well and start declining the ability for fungus to really grow in that area. So the question I often used to get asked is, Candida in the gut or in the digestive system, can that lead to fungal nails? Well, in most cases, no, because Candida albicans is a gut-centered microorganism. It will live there, it will thrive in there, it will be in balance and harmony with other fungi and bacterial species. And in most cases, it doesn't really lead to peripheral. Okay, so you've got a fungal infection right now. How do you get rid of it? Well, it's not going to happen overnight. The most common scenarios I found with patients, and I work with a lot of people with toenail fungus, is it takes 6 to 12 months to clear, providing they stop drinking the soda, providing they stop the alcohol, providing they stop that key food or trigger. It's got to go if you want to get rid of that fungal nail. You can keep on taking Lamisil, you can keep on taking pharmaceuticals, you'll knock the symptoms back, but it will just keep on coming back. What about other treatments you might have read online, like hydrogen peroxide at a 3% solution? Well, some people swear by hydrogen peroxide, and many other people I've worked with say it doesn't do a thing. It's the same with tea tree oil. Studies have found that 28% of people who apply tea tree oil twice a day can nail that nail infection within 6 months. But then there's that 60 odd percent, that aren't going to get much effect from it. You've got to find what works for you. And the only way you're going to do that is by trial and error, by trying different things. But I can tell you now, the key thing I find with nail fungus is the environment of the foot, and the lifestyle of the patient. How long are they wearing footwear for? And the diet of the patient. What are they eating or drinking that's contributing to the problem? Stress plays a more minor role because remember, stress increases cortisol, which suppresses immune function. So now think about it. If you're highly stressed, eating the wrong food and wearing footwear all the time, you're much more prone to getting a fungal infection and keeping that fungal infection. Okay, let's look at the best diet tips now for toenail fungus. What can you do? Well, the key thing is to reduce refined carbohydrates, stop soda drinks, stop alcohol, especially beer. Beer's a big one with this condition. You need to limit those foods or cut them out altogether. Second one is to incorporate probiotic foods into your diet and prebiotic foods. So look at a wide range of vegetables and fruits to include in your diet. Now some people say, but you shouldn't eat high sweet fruits when you've got toenail fungus. I don't see that being a problem. I see alcohol more the problem, and soda drinks and takeaway food and processed food to be more the problem. So my recommendations are for you to go into a fresh, healthy whole foods diet. Whether you're keto or vegan, I don't really care. You just need to eat fresh foods. And this is going to make a big difference to your gut. The other point is to incorporate antifungal and antimicrobial foods into your diet. So more spices, more herbs, more foods that are going to help to bring a microbial balance back into the gut again. So good additions here are things like garlic and ginger and coconut oil and spices like clove or cinnamon or lemongrass. They're all going to assist in reducing fungal levels. Dietary supplements definitely help. A good antimicrobial formula like our Yeastrix product, our Yeastrix Candida Cleanse, that's going to help to balance the gut. We've also recommended a good probiotic. I happen to make a 35 billion CFU, so colony forming units capsule. So taking a probiotic once or twice per day along with the diet change and the topical treatment. And then remember, we're going to take the socks and shoes off regularly, and we're going to expose them to sun and salt water. And all of these things are going to help you slowly get rid of that toenail fungus. Now here's the key thing. Take a photo of your feet every couple of weeks. Just take photos. You don't have to show anyone. Over the months, have a look at it and you'll see how the toenail's changing. And it could really inspire you to keep on going and to finally nail that nail infection. So I want to thank you for tuning in today and watching this video. Don't forget to like and subscribe. See you next time.